Hi, my name is Dr. Laura Willingham. I am a board-certified OBGYN living in Memphis, Tennessee. I'm also an assistant professor at the University of Tennessee Health Science Center in Memphis, Tennessee. Miss Fitzgerald asked me to talk to you guys a little bit about what it's like being a healthcare worker or physician during the current COVID-19 pandemic. So just a little bit about where I live. So Memphis, Tennessee is kind of probably the second largest metropolitan area in Tennessee. We've got the metro population, I think, is about 1.3 million or so. The hospital that I work at is the inner city hospital. Our population is largely on government-sponsored insurance, just to give you kind of a frame of reference. As far as the number of our COVID cases, the state of Tennessee, last I looked, last night has, I think, about 615, and the Shelby County, so the county that Memphis is in, has about at least, I think last I looked was like 93 cases. My hospital has had a few cases. Currently, we haven't had any women test positive in labor, but we have tested a few. So as far as kind of some of the changes that we're dealing with, kind of the big one from my front, so as an OBGYN, I deliver babies and do gynecologic surgery. One of the big changes that we've changed our visitor policy, which a lot of places have. Currently, we are only allowing one visitor in labor. We're lucky in that we're still allowing one visitor in labor. Some hospitals around the country are not. The challenges that brings for our patients is that with schools closed, my patients don't necessarily have extended family support, and so their partner often will have to be home with their other children because children are not allowed in the hospital. And so I'm having a lot of women go through labor and delivery alone with just the medical support staff that's there. So that's definitely been a big change. The other big change is that we've stopped doing all elective cases, and so that's a lot of gynecological cases are stopped, and so we're not doing hysterectomies or tubal ligations anymore. And the main reason behind that is to preserve personal protective equipment, so the masks, then the gowns and the gloves. We want to conserve that where we can, so we stopped elective cases. I am hospital employed, and so I'm still going to be getting a paycheck, which is nice. I know, so I don't have to worry as much about the loss of surgeries or the loss of clinic visits affecting my income because I'm hospital employed. But I know a lot of physicians, that's something that they're thinking about. On a more personal level, my husband also is a physician, so of course I'm worried about him too. But we do have a 2-year-old son, and so because we're both physicians, both at risk of exposure, and daycares are closed, we actually decided to send him to live with his grandparents for the foreseeable future, because we didn't want to risk exposing him or his grandparents who would be coming here to care for him. So he's been gone now. We sent him, he left on Saturday, so he's been gone for 3 days, so that's been hard. Let me see, I guess those are kind of the big things so far that we've seen. We all think that this is going to get worse before it gets better. Unfortunately, we're seeing kind of the increase in cases now in our local area. I know some other places in the U.S. have been hit pretty hard, and so they're seeing a lot more as far as a lot more impact. But it's kind of where we are right now. So it's still a great profession. I still love being a doctor. I'm lucky in that I get to care for patients, and I get to go to work during this time and have job security, which is also something that a lot of people are worried about. So good luck as you guys go through this process. Hopefully this will be over soon. And in the meantime, I encourage you all to 1, wash your hands, and 2, stay home if you can. Thanks. Bye.